Good afternoon to everyone.
pleasant afternoon to you all. It is my great pleasure to welcome you all for joining us today. And today's session is designed to focus on AI in healthcare industry. We have an eminent speaker to share invaluable insights with us. In the radiant glow of this afternoon, it brings me immense joy to present today's illustrious person, Soundarlakshmi Narayanan ma'am. She is the dynamic force behind Mind Over Matter, serving as its managing director located in Coimbatore, Tamil Nadu. This pioneering startup focuses on mental wellness. Her journey behind with a stellar academic record in robotic and automation engineering at PSG College of Technology, where she graduated as topper. She seamlessly merges technology with holistic well-being, setting apart in the industry. At the helm of Mind Over Matter, she leads a passionate team dedicated to crafting innovation programs and services for corporate mental wellness. Prior to this, she found success as the CEO and founder of Next Step Robotics, specializing in autonomous motivation. Notably, her prowess caught Tesla's attention, lead to hiring her during third year of engineering. Furthermore, her dedication to both well-being and technology education is highlighted through her online career coaching, where she shares her expertise in robotics, AI, and ML with college students. Her innovation spirit is evident in her efforts to reshape the fields of mental wellness and technology education. Presently, she holds the position of NISM Research Analyst and Content Creator at Grow. Her contribution have led to significant increase in subscriber with the Grow Tamil YouTube channel over 2 lakh subscribers. Since May 2022, she has collaborated on the creation of more than 250 plus videos on finance. She expertise in emerging technology is augmented by her exceptional team coordinating skills honed since childhood. Coupled with her proven leadership ability and technical proficiency, she has achieved notable success in various endeavors. Her privilege include being recognized among the top 40 women entrepreneur worldwide at TGS Singapore and winning the prestigious Best Startup Award for Thai Vadodara 2023. Additionally, she secured the second runner-up position in the Global Student Entrepreneur Award in Dhaka, Bangladesh in 2018 and was named the first runner-up in the Global Student Entrepreneur Award in India in February 2018. It is an honor to welcome a true exemplar of excellence and innovation, Soundarya ma'am, for joining us today. Welcome you, ma'am. I encourage each of you to actively engage, ask questions, and observe the wealth of knowledge that Soundarya ma'am will undoubtedly share with us. Now, I request Soundarya ma'am to take over the session.
Hello, am I audible? Hello?
Yes, ma'am.
Yeah, okay, Sibita. Thank you so much for the introduction. That is really nice. So, hope all of you had lunch. Is it your lunch time, or am I between you guys and your lunch, or how is it? Anybody, just put it in the chat box. Probably. Did you guys have lunch? Did you complete your lunch? Okay, so one person has told yes, they've completed. What about the others? Okay, I think okay. A lot of you have completed lunch. Okay, glad to know. All right. So today we are specifically going to speak about AI in the healthcare industry. We are going to speak about how we can use artificial intelligence for something which can save lives, for something which can help people, for something which can help others live longer. Okay, so that's what we're going to see today. I'll quickly share my screen. Just let me know if anybody is able to see it. Just give me a second. Okay. Just if somebody can acknowledge that you're able to see.
Yes, ma'am.
Yeah, awesome. Okay. So I want the session to be a bit more interactive. So if you can unmute yourselves and talk, or if you can put some answers in the chat box itself, I'll be very happy. So first, I want to start with just give me some examples on where do all of you think that AI can be used in the healthcare industry? Just some example. Where do you think AI can be used? Anybody, just unmute yourselves and tell me an answer or just put it in the chat box.
Surgery, ma'am.
Surgeries, okay. Robotic surgeries. More. Think about what happens when we go to a doctor. Diagnosis. Very good, Jayanti ma'am. Okay, next. More. Okay, so say I'm 25 years old. I go to a doctor today, and my doctor will give me a set of tests that I have to take, right? So there I can use AI and automate it. Yes, that's one possibility. Where else can I use? Recommendation systems in some websites. Okay. Are you meaning like medicine recommendation systems? Because I have seen that there are particularly certain websites where you can monitor the price of certain drugs, you can monitor the price of certain medicines and find out whichever website is selling it for cheap. For example, you can take medicine from Practo, you can take medicine from Netmeds. So they take all the prices from all of these places, like how Amazon, right? We use Amazon, we use Flipkart, we use things for purchasing our products, and we use a particular website where we can log in and see what was the lowest price of that particular medicine or of that particular product, right? So similarly, for medicines, there are sites that are available where you can do. There also a lot of AI is being used. So next is patient monitoring. Yes. Automatic message generation for doctor booking and follow up. Yes, that's a very big application. This comes into picture when say for example, my doctor has told me I have to take an MRI today, and I take an MRI today and I have some growth in my brain. And after he's giving me some medicines. After 3 months, I have to again take an MRI. Most of the times, we forget it, right? So we can use AI systems to automate this process. Even we can use AI systems to book our schedules itself with the provided the diagnostic center is okay with it, right? We can automate the booking system as well. So that is also one thing that's possible. So next is patient monitoring. Yes. Say we have really old people at home and there is no home nurse that we can afford to, we can actually monitor these patients remotely, get their glucose value, BP values through some IoT device, and send it over an API and get some recommendations on based on that. That's one good application, patient monitoring. So today we are going to specifically look into three applications that we are going to see, right? So the first one is diagnostics, second one is personalized treatment, third one is patient care. So ultimately we have to use AI in places where efficiency and outcomes can be improved, right? So if efficiency is not improved in particular process that I'm going to implement AI, there's no use in implementing it. And patient outcome, meaning the patient should live for more longer time, or the patient should actually live after whatever we have done as a diagnostic, right? So outcomes also should be improved. And how many of you are familiar with the process that happens within pharma companies for actually, giving okay to a drug? Is anybody familiar with what is the process that happens within pharma companies to give yes to a drug? Anybody? How many of you watch these? I don't know. There's nice series called Grey's Anatomy. They speak a lot about pharma, drugs, doctors, surgeries, and all of it. So what happens is usually a pharma company will have these people who will sit and do research on drug formulations, and they will come up with at least 60 to 70 types of drug formulations. So I'll tell you the process, how these formulations come into picture, how do they start to manufacture it, and how does a drug get approved before we actually consume it, right? So for example, say they hire a lot of biomed people, students, and they also have pharma formulist. Okay, so that is the name that they give to these particular people. So there'll be around 60 to 70 formulations that different teams will come up with for a specific disease. Say it's cervical cancer, right? So for cervical cancer, there'll be 60 to 70 types of formulations that a team will come up with. And the first thing that they do is they test it on mice or they test it on cat. Okay, so mostly for oncology related or treatment which should go for cancer, right? They do testing on mice or cats, and once they do testing on mice or cats, they'll get some data. And the mice, the cat, it will also have some heartbeat. You also monitor the blood levels. You have to monitor different parameters, right? So they'll have a small IoT device which will be attached to the mice or to the cat. and from that they will be getting the values, they'll be regularly monitoring. So when it comes to oncology based treatment or oncology based drug development, there will be three things that they will be looking for. One is tumor identification, meaning whether the tumor is benign or malignant. Benign tumors means you just can remove it and it won't come back. Malignant tumor is the one where cells keep on multiplying for a lot of times, and that's like the spreading cancer, right? So the tumor identification is the first step. Second step that they do is tumor results. In tumor results only, they look into various parameters like what is the size of the tumor, where is the particular tumor present, whether it's in the heart or whether it's in the lungs or whether it's in the kidney or pancreas or blood cancer or bone or whatever it is. They will look into all these parameters, and they will be taking into other type of how many of you know gene studies? Genomics is called gene studies, where they particularly take your DNA and find out that there is a particular mutant in your DNA which is causing this cells to multiply. Okay, so that's called genomics. They do genomic study. So this is done in the second step, which is called as tumor results. The third thing that they do is in these all these mice, no, which has this tumor identified and also has some tumors that is being present. What they particularly do is they put into all these 70, there'll be 70 formulations. They'll put into all these mice, and the IoT device will be taking care of the different levels that needs to be monitored. And the third parameter that they'll be taking into account is disease response. So every 7 days, every 3 week once, they will see that whether the tumor is growing huge or whether the tumor is growing small or whatever is the disease response. And once they understand the disease response, they will look into how the tumor was and how the tumor has progressed or how the tumor has reduced. And based on this, out of 70 formulations that they make, there'll be only 2 or 3 formulations that will be really promising, that will be producing the right results that it should be producing. And who helps these people understand that the formulation is right or wrong? It's us who are AI engineers, who understands certain trends, certain patterns within the data, and help them understand that this is working for this set of people, right? Or this set of mice. So AI engineers are the ones who does this full work itself, right? This is how the whole process goes. And post that, they will have clinical trials. Clinical trial is where they will have a set of people who have this particular type of cancer, particular type of mutant in their genomics, and they will be monitoring this drug. And there is 2 types of testing called open label testing and closed label testing. Open label testing is where a person or the say somebody is having cancer. Okay, this Rahul, there's a guy called Rahul who has cancer. So they will tell Rahul that you're getting either a placebo or a drug, right? So they will tell Rahul openly that you are either getting a placebo or a drug. A placebo is something which doesn't have any effect. It's just put in case. Okay. Why do we put placebos inside these trials is I hope most of you are aware that machine learning algorithms have bias, right? Machine learning algorithms, how much ever you try that, you will have some bias. You have to either prune those values or do some ratios to reduce those biases. Similarly, in clinical test also, you will have bias. So what they will do is they will have placebos also, and they'll also administer the original drug. Open label testing is where they will openly tell you that this is a placebo or whether you're going to get administer the drug itself. And closed label testing is where they are actually producing a new drug, okay, totally new drug that has never been available in the market. So those times they will take place only in closed label testing, because the person should not know whether they have been given a placebo or an actual drug. That will actually collapse the whole experiment and will create a lot of bias. So that's called as closed label testing and open label testing. Hope you guys understood the difference between both of this. Suppose this testing, they will again get the results, monitor the patient, monitor data of the patient. Again, they will look into these 3 parameters, that is tumor identification, tumor results, and disease response. And based on these ratios only, they will take and call that whether this should happen or not, okay, whether this drug is going to the market or not. And after that, they will take another 2-3 years to plan mass production of the drug, pricing of the drug, and all those will happen within pharma companies. So this is how AI can be used in personalized treatment or personalized drug repurposing. Okay, so now let's start with diagnostic. I think Jayanti ma'am had mentioned about diagnostic. Kudos ma'am, we can use AI in diagnostic. So how many of you are actually familiar with all machine learning algorithms? Just say yes or no in the chat box. Familiar with machine learning algorithms. So I know what is supervised learning, I know what is unsupervised learning, I know what is reinforcement learning, and I know different algorithms like logistic regression, k-means clustering, CNN, ANN. How many of you are familiar with all these algorithms? Yes, no. Yes, okay. I think Urmila ma'am has replied yes. What about the others? If you don't know, also please let me know so that when taking itself, I'll just put bits and pieces of the algorithms itself so that you can later go learn about it step by step and try it out on Python code or anything. Yeah. Sharmila ma'am also has told yes. If somebody doesn't know, also please do let me know. Right? Okay. So first thing that we will see in this particular topic is AI in diagnostics, right? So how many of you are familiar with MRI machine, magnetic resonance imaging machine, and X-rays? Say for example, I'm having thundering headaches, and I go to a doctor and I tell my doctor that yeah, okay, Sunny sir has also told that, yeah, okay sir, yeah, so for example, say that I go to my doctor and my doctor's telling me that Soundarya, I'm having thundering headaches. I just go to my doctor and tell him, and my doctor's telling that no, it's just your work stress, you'll be fine, take some medicines. And this happens like for 3-4 months continuously, and I go for the fifth time to the same doctor, and the doctor will tell me, go take an MRI of your brain and come back to me, let's do some thoughts on top of it. So what happens is an MRI reading, once you go, you do an MRI, you come out, the MRI result will go to a diagnostician, a person who's specifically done some studies which is specialized in diagnosing what is wrong with you, right? So this diagnostician is a person who will sit and who will read your report and write the 2 lines of conclusion, right? So usually you will see conclusion inside any MRI report or X-ray report, right? So they'll write like 2 lines of conclusion saying that this particular part of the brain is swollen or whatever has happened. They'll write like 2 lines of conclusion, and then once you read it, what we do is mostly we'll come home, we'll go to Google and we'll start searching what is this, what is that. We'll start searching, no, Google will start searching, and then we'll understand something. We'll go to the doctor and we'll be like, doctor, what has happened with me? Something is really wrong with me. We'll ask him, right? And what happens is the doctor will again look into the X-ray or the MRI that we have taken. Again, he'll be having a white color board where he'll be clipping it on and seeing it. And post that, he will be telling that, yeah, the diagnostic is right or wrong. And after that, he'll be telling that even though this diagnostic is there, you needn't worry about it. Just don't stress out. Just do some meditation, whatever it is, he will tell you. And then after that, he will give you some prescription for medicines. So this is the whole process that happens behind MRIs. But okay, there's a very big but here. The problem with these kinds of brain MRIs or MRIs that you take with brain is, brain is the organ which has less number of studies, or say if you take a heart rate, if you ask a cardiothoracic surgeon, they will know everything about the heart, everything about the heart. But if you take a brain surgeon or a neurosurgeon and you ask them, like, do you know what this part of the brain does or what this particular small piece of the brain does, they will not know, because brain is an organ which is not seen a lot, right? Research is still being conducted in different parts of the brain. So what happens is, a lot of times the diagnostician will forget to identify certain abnormalities, but it might come out as a tumor in the long term, or it might come as something which is like the brainstem is just moving this side or that side. It might come as a different diagnostic in the long term. This will be like 1 in million cases. This very commonly happens in 1 in million cases. So what people usually do is, oh my god, if the doctor had told us earlier itself, we could have saved this person. All these kinds of problems will come, but it would have happened in the history. Like say if like 100 years back somebody else, or say like 60-70 years back when the first MRI machine came, somebody had this problem, and this diagnostic was made for them. Okay, since people, so this diagnostic was made for a person in Kenya, but doctors in India won't know about it. So what happens is, if we get all these images as a database, store it in a place, and apply some convolutional neural network on top of this, because it's an image based segmentation, and you can identify whether there is a particular abnormality present or not in an MRI scan of a brain. So that is something that could be done. So this is how AI is used in diagnostics. Okay, what else is the biggest application of AI in diagnostics? I wanted to ask this. Say for example, you have a fever, you go to the doctor tells you that's a viral fever, and it is a time of malaria or dengue or all those diseases are going around. Immediately the doctor will ask you to take one particular test. They'll tell you in the test edutittu vaanga. They will tell you. What test will they ask you to do? Anybody can answer. You go for a normal fever, they are suspecting whether it could be dengue or malaria. They're asking you to take a test. What test will a doctor ask you to do? Very common test. CBC. So CBC, how do you get the CBC data? Blood test. Yeah, okay. Urmila ma'am has told it, right? So it's actually blood test. Very common test that is used in diagnostics for any disease. Okay, for anything you go to a hair doctor and tell that my hair is falling and give me some medicine. You go to a hair doctor, they will say first full blood panel test. So this is the first thing that your doctor will say, take a blood test and come back to me. So it depends. If you go for say hair test, they'll ask you to do a full blood panel test. If you go for a test for malaria dengue, they'll say CBC. If you go for a test for say I have high cholesterol and I go for go to my doctor and tell that I have high cholesterol because I've been eating a lot of fast foods, the doctor will immediately ask me to take a lipid panel test. Okay, so we are going to look into how AI is implemented in taking lipid panel test today, right? So I'll tell you the steps that we followed for automating this whole diagnostic. Most of the things that you guys told in the chat box will come as a part of this. So say, for example, there's a guy called Rahul. Rahul is 35 years old. He's an Indian male, okay? And he visits his healthcare provider. Say, for example, he visits Apollo Hospital for a routine health checkup. And the doctor is saying that, Rahul, please go and take a cholesterol level checkup, okay? And she is taking a sheet and writing lipid panel test and giving it to Rahul. So Rahul is going to the diagnostic place and he's taking a lipid panel test. So in lipid panel test, what all you will be taking? So there will be 4 parameters that you will be mainly getting in lipid panel test. First is total cholesterol. What is the total amount of cholesterol that you have within your bloodstream? Second is low density lipoprotein, LDL cholesterol. So if you eat a lot of trans fats, if you eat a lot of chips, potato chips, these kinds of French fries, finger chips, cheeseburgers, or anything that you get in McDonald's or in these kinds of fast food chains, it will give you LDL, which is low density lipoprotein. Okay. And next is HDL data. HDL is high density lipoprotein. That's like a good cholesterol. Okay. A lot of them say that if you eat ghee, you get high density cholesterol. So they'll say ghee is good cholesterol. So recently, I took my parent to a doctor and we took this test. Okay. And the doctor told that instead of using oil in your dosa, you can use ghee in your dosa because it is good cholesterol. So HDL will tell you about what is your good cholesterol level within your blood. And next is triglycerides. So these are the 4 parameters that they will ask you to take. I don't know how many of you have seen this ad. Okay, there's this green tea ad. I think it's Lipton. They will say that this particular green tea is filled with triglycerides, so it's good for your heart or something. They will tell this and put it in the ad. I'm not sure. I think it's a green tea ad. So what is particularly happening in this particular spaces, these 4 things are taken into account. So what happens is when Rahul goes and gives his blood test, they get this data from the lab. What they will do ideally is there will be a diagnostician who will be sitting and who will be looking, okay, LDL level is above 130. Okay, this guy has high cholesterol. Okay, that's all. Go. That's all. Then they will go to the doctor. They will sit with the doctor and the doctor will say that you have high cholesterol. So what you have to do is you have to stop eating fast foods and then you have to take this particular medicine. I think statin is a medicine given for cholesterol, high cholesterol in the bloodstream and arteries. So doctor will prescribe you some medicine and doctor will tell that you have to do all this. And after 3 months, again take another blood test. We will see how is your cholesterol level changed. Right. So after 3 months, what most of us will do is we won't go and take test because obviously Rahul is only 35 years old. So what he'll do is, I'm so busy with my work, I'm studying, I'm working in IT, I can't go take test and all. Ipodiki doctor has given this medicine. After 3 months, I'll simply continue the medicine. This is what a lot of people do, especially in India, because if we go to hospital, it will take at least 1 full day of our time. You go to a hospital, you do a consultation, you go give diagnostic, you go again back to get the report and come and then give it to the doctor. So it'll take a lot of time out of our schedule, right? So usually we do that. So how you can use AI in this particular places, you can analyze the lipid panel data using decision trees. So how many of you have used decision trees? Yes, no. How many of you have used decision trees? It's an ML algorithm. So how many of you have used decision trees? Anyone? Yes, no. Yes, no, yes. Okay, fine. I don't know. Anyway, so I'll tell you what happens. No. So Sunday has not used. Okay, fine. So I'll simply tell you in normal words, okay? Nothing technical. I'll tell you in normal words how is a decision tree or what happens in a decision tree. Okay? Say for example, LDL level, HDL level. LDL level greater than 130, which means it is true. If it's true, it goes into the branch. From the tree, it goes into the branch. And LDL level greater than 130, age greater than 45. Again, it goes into another branch. So that's called as a leaf node. Okay. So tree, branch, leaf. So like this way, you have to propagate decisions. That's basically a decision tree, right? So for example, we have 4 parameters. So we'll be having 4 different paths that it will go into, or 4 different branches it will go into, and based on different decisions and conditions, it can move and give an end result. That's it's as simple as what decision tree does, right? So decision tree is basically like a tree which has branches and leaves that can help you take a decision. It's a machine learning algorithm. It's very simple to implement as well. You can do it in Python. So what happens is, for example, the person has high or elevated LDL cholesterol level. So where do I get the actual normal cholesterol level? Say for example 110 is the normal. I'm just telling random values, don't take this as the right ones. Say 110 is a normal cholesterol value. So where do I get this data? I will get this data from the doctor. Okay, the doctor will say if you have cholesterol within 100 to 120, it's permissible. I don't know how many of you have read this blood test by yourselves. So in blood test, right? So I'm not sure how many of you have read it by yourselves. So in blood test, they will write like, this is the test that we took, this is the value you got, and out of this, if it's a male, this is the permissible value, if it's a female, this is the permissible value. They will write it in the report itself. Okay, so these are the places where you will get whether this is permissible or not. Again, all these permissible data will change according to ethnicity. So if you have categorical data which is going to come from different countries throughout the world, you have to take a category called ethnicity within your algorithm as well. So that is one thing to be noted. So what will happen here is elevated LDL cholesterol level. I understood that. Low HDL, meaning your good cholesterol is very low. And there's an abnormal ratio of total cholesterol to HDL. So they take ratios. TC is to HDL, TC is to LDL and all of it. And your triglyceride level is too high. This means that you will get a heart disease very soon. Heart disease can be anything. It might not be just a cardiac arrest or a heart attack. It can be anything. There are hundreds of heart diseases that this person might get. But Rahul is only 35 years old. Can I just tell Rahul that you're going to get a heart disease? Something is wrong with you. You have to immediately stop eating. I can't do that, right? So I have to understand Rahul as a person. An AI algorithm can tell you that, okay, this person has this problem, he has high risk or low risk, that's all. But you have to take into considerations categorical data that we are going to see in the next slide, right? So the categorical data will include Rahul's age, Rahul's gender, Rahul's family history and lifestyle factors. So Rahul, does he consume alcohol? Does he consume fast food? What is his age? What is his gender? Is he a male or a female? So people say usually female have less heart attacks than male, right? So gender data also is one categorical data that you should take. Say diabetes, right? Say if the father has diabetes, son will also have diabetes. Father has diabetes, daughter will have a diabetes. Father or mother or somebody like grandfather had say your grandmother had breast cancer, you will have the gene for breast cancer as well. So that's why you have to always take family history into consideration. If your father has cholesterol, you're highly likely to have cholesterol. If your father had some cardiovascular disease for which they had put some thing inside his, they have done some open heart surgery or anything, you are also highly susceptible to have cardiovascular disease. So if you take all this age, gender, family history and lifestyle factors into considerations, and you will already have this data, which is like 70% of data, which will be already given to you by the doctor saying that this person at this age, this family also had this and this is what happened. So this is what you'll be feeding into your decision tree for taking the decision, right? So based on all these factors, now if you put it in a decision tree, the algorithm will give you output saying whether they have high cholesterol or low cholesterol. And based on these kinds of categorical data like age, gender, family and lifestyle factors, you will understand whether they have high risk for CVD, which is cardiovascular disease, medium risk for CVD or low risk for CVD, right? And as ma'am has mentioned, I think Urmila ma'am or Jayanti ma'am, as they have mentioned, the AI algorithm on your WhatsApp itself will tell you daily morning eat this, afternoon eat this, night you can eat this, based on whatever the categorical data that this person has given to the doctor or this person has given to us, so that we put it in the algorithm. And this AI itself will schedule the next date, provided our AI is connected through an API to the diagnostic service provider. You can schedule the next test date and it will already do the payment and everything for you, so you won't skip that particular date or you won't forget that particular date, because after 3 months no one's going to remember, right? So all those will be automated through AI. This is how AI is used in blood test. I'll show you how decision tree works in a very simple way. So, for example, say if total cholesterol, TC's total cholesterol is greater than 200, okay? If total cholesterol is less than 200 means it's a normal. So they will give a result as normal. If total cholesterol is greater than 200, if low density cholesterol is greater than 130. If it's not greater than 130, meaning your high density cholesterol is higher, right? So again, you will get the result as normal. But if LDL is greater than 130 and your good cholesterol is less than 40, okay, then it will go into again next triglyceride. If triglyceride is also greater than 150, then definitely I have high cholesterol. In this particular example, I have taken into account only one particular or two particular factors, right? Okay, three particular factors I have taken into account for understanding risk of a person: age, their lifestyle habit, meaning how much they consume saturated fat and trans fats, and also the family history of presence of cardiovascular disease or a high cholesterol, okay, within the family itself. So somebody's age is greater than 45, they have high risk for, they already have a risk for heart attack, right? Next, if saturated fat consumption is greater than moderate, and trans fat consumption also they do. Trans fat consumption comes through all these kinds of packed goods. That's why people say don't eat packed foods, don't eat chips, don't eat these Maggi instant noodles or anything. They all have trans fat, okay? So even if it's greater than low, you are consuming trans fat. So if you consume that also and your family also has risk of cardiovascular disease, you are in high risk category. But if your family doesn't have this high cholesterol or CVD disease, then you're in moderate risk category. But if you don't consume these kinds of packed foods, again, then you're in moderate risk category, because you still consume saturated fat, right? In the name of potato, in the name of chips, finger fries, cheeseburgers, and all of it. So again, you'll be in that. And again, if fast food consumption is actually not low, but it's moderate, and your LDL is also very high, means you are a high risk category, right? So this is low to medium, this is moderate to high. So that is how you put these things into a decision tree and take a decision. So this is how your algorithm will basically work, right? So the result has, yes, somebody has a doubt or a question? Okay, so the result shows that this person has saturated fats and trans fat consumption is kind of high, and you have to take into account his age, his gender, family history, and lifestyle habits, which are categorical data. And based on this categorical data, you can again use the data that you use, the result that you have got from the numerical data, use it in terms of categorical data or mix it and use, and you can get a output saying that this person's lipid panel test has come out that he has high cholesterol and high risk for cardiovascular disease. And instead the doctor will tell us or advise us saying that eat green leafy vegetables, nalla diet richa protein richa சாப்பிடுங்க, whole grain சாப்பிடுங்க. They will tell you eat lean proteins and take your medications on time. Lot of us, what we do is sometimes we just travel, we see a pani puri shop or we see some vada pav shop, we feel like eating it and we'll immediately take and eat. And most of the times, since Rahul say he's 35 years old, although he's 35, he's not married, so he has nobody to take care of him. So what he'll do is, it's okay, I don't have time to cook also, so I'll eat whatever I want. But instead, AI can be used in sending these kinds of reminders as WhatsApp message to Rahul saying that, hey, this is your doctor from so and so hospital, have you ate this today? And this person can acknowledge yes or no. And based on that also, they can give a patient monitoring. They can do a patient monitoring, and a very personalized connect with the patient also is something that could be given to Rahul, right? So next date also could be fixed. So these are all the applications of AI, particularly in blood test, which is very common, right? So next thing that we're going to next thing that we're going to see is personalized treatment. So how, as I think everybody who are present in the call remember how I told you that cancer treatment works, right? How drug production and cancer drug production works. I hope everybody remembers. So the first thing is they will have a lot of people who are called as formulators. These formulators will be like different teams. They will come up with 70, 80 formulations for a particular mutant of cancer DNA, or the cells or the DNA mutation or the gene mutation. That's called genomics. And what they will do is post this, they will have a lot of mice and each of these mice will be having targeted tumors in different areas. And what they will do is they will take into three parameters into account. First is tumor identification, tumor results, and disease response. Tumor results is what is the size of the tumor, what type of tumor it is, what is the genetic mutation, what is the molecular biology, and all of it. Next is disease response, where they will introduce different formulations into different mice. Say they have 70 formulations, they'll put different formulations into different mice, and they'll monitor how small the tumor becomes or how slowly the disease progress. And once it is done, out of 70, 80 drugs, there'll be only 2 or 1 promising drug that will go into clinical human trials. And only after it goes into clinical human trials, it will move further, right? So this is how the whole process where cancer personalized treatment happens. So I don't know how many of you have personally experienced cancer. I was traveling to Singapore, and there was this particular startup which was doing these kinds of personalized treatment, especially for cancer patients. Say, for example, a person X, her name is Jyoti. Say Jyoti has got breast cancer, right? So for breast cancer, there are 5 different types of drugs that can be delivered into Jyoti, so that she can fight breast cancer. Stage 3, there are 5 different drugs. Stage 4, there are 5 different drugs. There are different types of drugs, but it's up to the doctor to look into various diagnostic report and take a decision that this is the drug that should be first given to Jyoti, and after that only drug 2 should be given, drug 3 should be given, drug 4 or drug 5, whatever it is, right? So this 2 1 3 4 5 or 5 2 3 4 1, whatever is the line of the drugs, that or line of the treatment that should be done step by step, is actually decided by the doctor. And there was this company who was doing research on this particular field of cancer treatment and cancer drug deliveries, and they understood that a lot of patients who had died in the past, okay, could have been saved and could have lived like 9 or 10 years further. Why? If they had been delivered the right drug. Okay, say for example, somebody started with drug 5 treatment, okay, and they died in like a year or so because the cancer has progressed very hugely. uh, they have made a AI algorithm which found out that if they have been monitored drug 2 instead of drug 5, they would have lived 9 years extra. Okay, so this is like within a family, if you get cancer, no, it takes away everything that you have. It takes away money, it takes away your peace of mind. It's a very difficult disease to be with. So this particular company found out that this particular drug could be given to them based on trend analysis and pattern analysis. They found out if you have this particular mutant gene inside your DNA, this particular drug works well if that is given first or that is monitored first to you. So this is what is the whole personalized treatment and how it works in cancer. So now I think you understand how does a drug starts with this formulation and goes to clinical trials, and how does it helps patients who have some particular type of cancer. So I'll tell you what happens, or what are the different types of tests that people take in cancer. Okay, first is genomic analysis. So genomic analysis, nothing but they do a genetic study. And find out which tumor drives the mutations. Okay, so inside a gene there'll be a lot of small chromosomes, right? So they find out that which particular chromosome is actually the mutant chromosome, which is responsible for the multiplication of cells. Cancer is nothing but over multiplication of cells in a particular area where it shouldn't multiply. That's all, right? So they find out which mutant is responsible for this tumor growth. Okay, and if they find out that this particular mutant will work only with drug delivery, they will do targeted therapy, only drug delivery to that particular place in your body. If they understand that this particular mutant will die only if you give chemotherapy, that will help you understand that you have to do targeted chemotherapy to that particular place. So that is what they'll be particularly doing. Next is treatment prediction. So as I told you, we have these databases, medical databases that you can get from Cancer Research Foundation. So in these medical databases, you can understand what are the different treatments that are available. As I told you, 5 4 3 2 1 or 2 5 3 4 1, whatever it is, these types of drug which should be given first, which should be given second, is decided by the doctor. But AI can do better predictions because it understands the trend analysis, it understands genomics better than us. Okay, it understands decision making better than us. That's why you use AI for cognitive task, right? Next is drug discovery. Say for example, a patient in India has a breast cancer with a mutant in D2 chromosome. Okay, say another patient in USA has bone cancer with the same D2 chromosome. right? And this lady who has got breast cancer, they've administered her some drug and it worked very good for her. But for bone cancer, there are really no drugs that are particularly available. You have to either take the bone out, you have to put in a different transplant or whatever it is. But this person is not ready to spend so much. So what they can do is, if the mutant is the same mutant, they can repurpose a drug and identify that this particular drug cannot be used only for breast cancer, but it can be used wherever the mutant is similar. So they can do drug discoveries through AI as well. And they can take clinical decision support. They can analyze the real-time data of any patient, and they can see whether the growth of the tumor is within permissible levels, within permissible guidelines, or if it's actually reducing, uh, or whatever is the hypothesis, is it coming true or what, and they can enhance the treatment option, especially in oncology. And next is radio mix. Radio mix, so I told you that there is this particular parameter that you will take into cancer research, right? That's called as tumor results. So tumor results is particularly where you take into account your tumor size, your tumor's position. These are all categorical data and also a mix of categorical and numerical data. Tumor size, tumor count, what is the mutant. So all these things you take into picture, and there'll be a lot of images also that you will be taking into picture. And radio mix data along. So this is how you monitor the ideal or the starting tumor results of your tumor. That is radio mix. Through radio mix only it's done. Next is you can monitor the treatment of the patient. You can see what is your response, what is your adjustment that you can do for the treatment plan and all of it. After that, you can do a patient stratification. Stratification is nothing but clustering of people into subgroups. Say, for example, these amount of people have similar molecular profiles, so they are going to have the same type of chemotherapy treatment that's going to happen to them, where they start with chemotherapy 50% on the first cycle, and after 3 weeks it becomes like 60%, 70%, and it can just progress. So these are all things that could be done within this. So I'll tell you guys something. I'll tell you what all algorithms is particularly used. So for genomic analysis, you can use random forest, support vector machines, or convolution neural networks. So since I think most of you are aware of the algorithms, I'm letting you know what algorithms you can do. But based on categorical data, numerical data, you can use one of these or combinations of these algorithms. And for treatment prediction, you can use decision trees, random forest. Those two work really good. For drug discovery, you can use graph neural networks that has seemed to proven or give really good results. For clinical decision, obviously you have to use some NLP because you're going to communicate with the person, and you can take Bayesian networks. That also works well. For radio mix, you have to take convolution neural networks because it has image-based data. For treatment monitoring, since it is like a time series analysis, you have to do a time series analysis technique or a long short-term memory technique. That works well. For patient stratification, meaning you're just putting patients into different clusters, right? So you have to use clustering-based algorithms like K-means clustering, hierarchical clustering, or density-based clustering. So this is what you are supposed to do, right? So next thing that I'm going to show you, so this is personalized treatment. Next thing that I'm going to show you is health assistance or patient monitoring. So what you can do is 24/7, you can monitor a patient. You can send them notifications saying you have to take your medicine today, and you can get feedback from it's like more of reinforcement, right? Getting a feedback from a patient that I have taken my medicine today. It's like reinforcement learning. So you can tell that I've taken my feedback. Yeah, I've taken my medicine today. They can get that feedback. You can look for health advice. You can give for medication reminders. You can look for you can monitor the vital signs like what is your glucose level, what is your cholesterol level, what was your recent blood report. You can monitor all this, and this will improve the engagement of a hospital with the patient. That's why you go for virtual healthcare assistance. So this is how they do in healthcare industry, especially physical healthcare industry or disease-based healthcare industry. So now I'm going to show you a small demo of a healthcare, chatbot that you can we have actually created on WhatsApp that you can actually talk to. And this chatbot, if you have any problems or if you have any mental health issues, you can go talk to the chatbot. This is fully created with our own database, with our own training models. Just give me a second. I'll just quickly share my screen and show you a small demo of a chatbot. See, post showing the demo of a chatbot, I'll send a chatbot's number that all of you can chat with on, on WhatsApp. So you guys, if you have any problems or if you have any issues at work or some stress, depression, anxiety, you can go talk to the chatbot and get some quick reminders, quick exercises that you can do to come out of it, right? So we saw physical healthcare and how AI is being used. I'm going to show you an example of mental healthcare and how AI is being used in mental healthcare. So let me just quickly share my screen and show you a demo of a chatbot. Just give me a second. Yeah. I hope my screen is visible. Okay. Uh, So you guys can see that this is our chatbot. Chatbot's name is actually Mind Over Matter. This is created by our company. I'll show you. I'll share the number of our chatbot as well. So one thing that I would like to request all of you is this chatbot is for showing a demo to all of you. Please don't share the number with everybody. It's just for the 100 of us who are present in the meeting today. So you guys can use it whenever you want, but not for outside of the group. But I'll tell you what you have to do in the chatbot and what you can talk about, right? So say for example, um let's take an example like I am having difficulties. Say okay, let's take an example for professors. Professors have a lot of administrative task along with a lot of task where you have to teach kids also, right? So I think both happens for professors, and mostly sometimes for most of the professors administrative tasks are kind of like, takes a lot of your time. So for example, say you're frustrated, and you submitted for some paper and your paper got rejected and you're kind of frustrated. It's almost end of the year and you have to submit to your management that you have completed like 10 papers, right? But you're not able to complete it. Say for example you're stressed because of it, so you can go to the chatbot. The chatbot is asking you like, what brings you today, what do you want to do? You can say that I'm feeling stressed because I have not completed my paper submission for the say computer application conference, and I have surpassed the deadline. Scared that my boss is going to scold me. So you can just talk to your chatbot saying whatever you feel. Say you have kids. Most of us, professors have kids. So you can say that my kid is not studying well. You will be stressed about that. So you can go and talk to the chatbot and get some therapy from the chatbot itself. So it's saying that, see, it seems like you're under a lot of pressure and missing a deadline can be quite stressful. Yeah, I'm stressed, obviously. So it's asking you if we can work on some strategies to manage our feelings and to prepare for a conversation with your boss. So it's asking you, let's do some CBT exercise to address this. So I'm saying, yeah, why not? Let's just do it. So I'm telling you, yes, I can do this particular CBT exercise. Say, for example, you have problem with your husband at home, you have problem with your kids, you have problem with your mother-in-law. You can talk about whatever you want and it will give you something. Say, for example, it's asking you to do a cognitive restructuring exercise. So we have trained our chatbot to particularly be an expert in cognitive behavioral therapy, right? So that's why it's giving you cognitive restructuring exercise or any exercise which will be related to cognitive behavioral therapy. So say, for example, your negative thought is, my boss will scold me for missing the deadline. Your challenge is there any evidence that this will happen? Have you been in a similar situation before? We can reframe these thoughts. Say, for example, I missed my deadline last year and I got an extension of 15 days from my boss. So you can tell, I got an extension of 15 days. So this is what happened to me. What can I do now? Is this going to repeat or what? So I can ask the chatbot and the chatbot will tell me that, see, that's a very helpful piece of information. So the chatbot is telling, instead of thinking that, my boss is going to scold me and getting stressed about it, chatbot is telling you, instead of fearing, reprimand, consider that your boss may be understanding and could offer you support and extension again. You have to communicate it properly with your boss. You have to plan to speak very honestly about the situation and ask for guidance. So it's asking you, how does it feel? Yes, I feel better now. Say you feel better. You can say, I feel better. So now it is telling that you have to stress is root. See, it's also helping you understand that your stress is particularly rooted in the anticipation of your outcomes. So if you focus on constructive action, like going and talking to your boss, it will alleviate your stress and worry. So that's what's telling you. So once you complete the conversation and tell that, yeah, I feel better, the chatbot is going to ask you, like, before we wrap up, can you rate the chat from 1 to 5? Say I give a rating of 4. And the chatbot will tell you, yeah, thanks for this rating. I will keep improving. So this is kind of supervised learning that we have done in the start, where we had like a fixed set of questions and a fixed set of answers, and post that we did an unsupervised learning on top of it, because everybody's scenario is going to be different. So I might have a problem with my boss. Somebody else might have a problem with their husband. Somebody else might have a problem financially. Somebody else might have a problem with their wife. It may be different problems, right? So based on all this, we have to do some unsupervised learning. So whenever somebody speaks about stress, we have mapped all of those into particular exercises that they should do. Similar mapping is what we have done for unsupervised learning. And how do we improve our chats? How do we make sure that the AI is giving the right information to the right person without any biases, with the right empathy? Okay, so for that, what we have done is we have done some kind of reinforcement learning, where we get feedback from the user saying that you rate this chat out of 1 to 5. And if somebody gives a 5 rating, we're going to continue with it. If somebody gives a 1 rating, we're going to see what wrong happened with it, again reinforce and learn. So that is how the whole chatbot is basically designed. So what we will do is, I'll give you the chatbot's number on the just give me a second. So this is the chatbot's number. I've put it on the chat box. You guys can see and message to the chatbot on WhatsApp. This is only available to you people. Okay, not for anybody else, just for the 100 of us who are here. You can chat to the chatbot, and whenever you give a chat, complete the chat. Don't go in between your exercises and stop doing your exercises. Just complete the chat and make sure you give in a feedback, so that from our side also we can do some better learning using our AI as well, right? So this is the number that I've given, 948756286. You guys can try it out and let us know how it works for you. Based on your feedback, we can help a lot of mentally unwell patients, or patients who have mental wellness problems, like they are stressed, they have anxiety, they have depression, they want to do something extreme, they are very sad. We have to help all these people. So that is why we have started this chatbot service that we are giving to a lot of them. So we will need all of your feedback as well on how it can be improved. So don't forget to give the rating after you complete chatting with the chatbot. Right. So next thing that we're going to see is data security and privacy. So whenever you're dealing with medical data or healthcare data, you have to always make sure that you have everything private and confidential. So for having private and confidential and crucial information, usually you get some certifications like data security certification. You do a penetration testing and you understand whether your data is secure or what. And we have done a lot of those testing for any product that we have created for healthcare out of our business. So you have to ethically consider that. Say I tell that I have depression today. So my data that I have depression today should be confidential, right? Nobody else should know it. Say somebody else has a heart problem, they shouldn't know. Their opposite house person shouldn't know about it unless they go and say it. So that's how security and ethical guidelines are to be taken into a picture whenever it comes to especially healthcare. So considering challenges and ethical considerations is, say for example, there's a lot of patient data. There might be some kind of greedy pharmaceutical companies who might get access to all of this data and understand that a lot of people are going to be depressed in the next generation, so I have to develop a lot more depression drugs, right? So these kinds of ethical considerations should be taken into picture. You should not give your data to some pharma companies or to some person to sell it. So these types of ethical considerations, these kinds of rules and laws are just starting to come in India. But again, it's up to us that we have to 100% use AI ethically, right? So for example, say our AI is there, and I say that I have say bipolar disorder. So bipolar disorder is a particular kind of disorder that is a mental health problem. Okay, it's not a mental wellness problem. So ethically, when you're using an AI, you have to make sure that you have to treat bipolar disorder, or you have to give medications for bipolar disorder, or you have to give medications for depression only based on if this particular problem can be solved through AI, or it cannot be ethically solved through AI. An AI cannot prescribe medicines to any clinical patient. So you have to take into all these things into calculation. So what will tell you is what information or support do you want is what. Say I need medicines. It will give you some suggestions, but it'll tell you that it's not ready to prescribe medicines. It should not be prescribing medicines ideally. That's how you have to ethically consider when you're designing any kind of AI around anything, right? See, for example, we have trained a model to not prescribe any medicines. So our model will reply to you as a digital assistant we specialize only in mental health. We do not recommend you, or he will just tell you that I recommend you to go to a psychiatrist or a healthcare provider for prescriptions and medicine management. Schedule an appointment with your doctor. So it will tell you if you're feeling overwhelmed or if you're feeling very stressed or anxious about it, then you can talk to me. But if it's for medicines, you cannot talk to me. Right? So this is how ethically you have to always design your AI products around ethics, right? So next thing is future possibilities is what you have to do. You have to always collaborate with some healthcare professionals, people who are good data scientists who can find the right statistical models to be put on the data that is being given. Next is people who are technology experts who are good in app creation, Python, web development, and all of it. So those are the second type of people that you will need in your team. And third is clinicians. Clinicians are people who will have the data, or diagnosticians who will have the data, who will help you understand that this is the permissible amount. This is how it will work. These are the exercises mentally that we can give to somebody. So all these three people should be involved in order to make sure that the decision making is better. You have proper workflow on what happens ideally when a patient goes, and you can improve your patient care and monitoring. So this is what I had for today's presentation. So AI, you can enhance diagnostic, personalized treatment, and these kinds of chatbots that I had showed you today. So this can make sure that the patient is getting more personalized care. A person feels that I'm always with someone, I'm not alone, I'm always with someone, somebody is already always monitoring me. Because as a country like India, it's very huge. We have less amount of medical professionals in compared to the whole population. So when the population, a lot of people got COVID, right? We didn't have enough beds. Why? Because nobody anticipated so many people will fall sick in the same time. So when we are in a highly populated country, using these kinds of AI to be your therapist, AI to be your mental health professional, AI to be monitoring your medicines, AI to help you give diets, all these things is going to be how the future is designed. So yeah, thank you so much, guys. So this is me on LinkedIn. You can find me on LinkedIn. My name is Soundarya Lakshminarayanan on LinkedIn. Just give me a request. If anybody is ready to look into some possibilities of doing some research or anything related to AI in healthcare, especially mental health, do connect with me. Thank you.
Thank you so much, ma'am. It was a wonderful session.
Thank you, ma'am. I think I can log off now.
Just a minute,
I'm
ma'am.
just a participant. I'm not an organizer.
Oh.
Maybe you can ask organizer.
Oh, okay. I thought Lavanya ma'am was speaking. Okay, who was speaking then?
No. Yeah.
Okay, Anita ma'am. Okay. Thank you.
Yeah.
Hope
Thank
it
you,
was
ma'am.
useful. Thank you, sir. Yeah, so hope it was useful. If any of you like to connect with me, do connect with me on LinkedIn. And I'm open for research, especially in mental health areas, researching into X-rays or MRIs that can be done for mental health, for brain scans and all of it. So that's what we are particularly specializing in. So we have shared a chatbot's number also. Please do use and give us some feedbacks. If you find something not working, if you find something working, also do let us know. We want to make sure that anybody who's coming to us gets access to better mental health. So that's what is our mission, and that's what we are moving towards. I hope all of you had a really amazing time with our presentation. So I'll share the presentation with Lavanya ma'am as well. You can get a copy of it from ma'am. I think that'll be useful. If you guys have any doubts or anything at all, you can always contact me. Yeah. Thank you.
Now, for participants to engage with Soundarya ma'am to address any questions or concern about today's lecture.
So if any of you have any questions or anything also, you can let me know. Okay.
It's
Yeah, Sibita, I think questions, I think we'll probably take it on LinkedIn or anything. So yeah.
okay, ma'am.
Yeah, sure.
Seems there is no query from audience side. The feedback link is posted in the chat box. Participants, please take a moment to share your feedback. The link will only available till 4:30 p.m., which is also served as your attendance confirmation. Certificates will be issued on Monday for that at least you have and 3 days attendance. Finally, we have come to end of 5 days international 1 week faculty development program organized by Department of Computer Application, Kongu Engineering College, Perundurai, Tamil Nadu. We express deep appreciation to the organizing team for their dedicated effort and to distinguished faculties, researchers for their enriching contribution. And we extend gratitude to our esteemed eminent speaker for sharing invaluable insights. Thank you for all being part of this journey towards academic excellence and discovery. Hope we will approach in future with the same renewed enthusiasm and a collective commitment to learn and grow. Thank you, ma'am.
Ma'am Soundarya ma'am, I have one question from your side, from my side. I am
Yes, sir.
Prabhakaran from Presidency College from Karnataka, Bangalore. So actually, we are a teacher, no, actually. So as you given some digital assistant, so we want to develop some related to the student counseling as a one project. So can we guide for that? Because we are students are facing a lot of students are need some a number of people or students need that some counseling for their personal issues and all. They are doing something they are doing in the background. So we're not able to identify those things. So for that, I plan that. Really, I'm appreciating you that. Yeah, you are given a wonderful presentation today because when I'm seeing this project and all, I seen last 3 years back itself as an idea. I'm saying as an idea only because when I'm going to counseling with a number of students, they are facing a lot of problems. They are not telling with even a friends also they are not telling something. Even a parent also they are not saying. So for that reason, I want to have an idea for to develop the to assist with the digitalized. So can we support for that?
Yes, sir. We will definitely support for that. So the
So
current
already it
chatbot
is there. Now I
is
want to. I need one conclusion that whether it is available already because my idea is this is
yes, yes.
one my idea actually. This
Yeah,
idea
yeah.
is, has been proposed in last 3 years back itself. I have been
Hmm, hmm.
because I faced a lot of problems with this new kind of students of peer batches coming now.
Yes, yes.
But because a lot of environment is changing.
Yes,
Because of after COVID, the activity completely about the student is completely changing.
yes,
They are always cheating all this and all the aspects. They are telling all the lies. They are
yes,
not
yes.
telling
They have a lot of
openly. That is
problems,
the thing
some
we are
issues,
facing after
anxiety.
COVID. When we are
Yes,
as a
yes. A
teacher,
lot
we
of
are facing less.
yes,
For that reason, I that time even the only thing is they are not beaten me, madam. Openly I can say that. So have been aggressively. They are reacted nowadays. The people they are not. They need more number of assistant as a counseling
true,
as a
true.
counselor. So for
Mhm.
that reason, I'm asking that. Now the trend is environment and everything is changing. Platform everything is changing. So for that reason, I need from your support to develop this particular project. Are you able to support or not?
Yes, sir. We'll definitely support. Actually, the current chatbot that we have is being used in two big colleges in Coimbatore for their student counseling services. So, what we ideally do is using our chatbot itself, students can talk about whether they are stressed, anxious, they have relationship issues, they have breakups, or they are feeling like they have to commit suicide. That is quite happening in the student community. They can speak about all these kinds of problems within the chatbot. And if a student says that they are feeling very hopeless, they want to commit suicide, that is the time where we will connect the student directly to a in-house counselor who can come like weekly once to the college, and they can actually do a counseling session for the student. And for the student, we do an whole analysis of whatever they have spoke to the chatbot, and we give it to the therapist only. We email it to the therapist saying that these are the problems that this person has faced in the past 1 week that they spoke with us, and they are feeling very unhopeful about their future, and you need to give them therapy based on all this. So the therapist will also have a student history or whatever problem they've already underwent, and it will be easy for the treatment start as well, sir. So we are already doing it for like two big colleges and a few other corporates as well. We would really love to support you, sir.
Okay, ma'am. Welcome, ma'am. I want to know about the complete background what you are doing a lot related to the project.
Hmm.
So I want to upgrade. At least I want to do some features I can able to add it with the project.
Hmm.
So I will contact you very soon, ma'am. Thank you.
Definitely, definitely. So
Thank
you
you for
can
the
get the
organizer.
number from
Really, thank you
Lavia
for the.
ma'am, or probably connect with me on LinkedIn. That'll be great. Yeah.
Okay, fine, ma'am. Thank you. Welcome.
Okay.
Thank you for the organizer. Really, what you have done is very well. Apart from your I give the thanks for the management along with the organizing people and your department people. Thank you so much.
Thank you, sir. Sibita, you can conclude.
Especially, we thank Soundarya ma'am for joining us today and giving us a wonderful session. Thank you so much.
Yeah. Thank you.
Once again, I thank for all the researchers for joining us for this today's session. Thank you.